Hello and welcome to the Giving Voice to Depression podcast, produced in partnership with the A.B. Korkor Foundation for Mental Health. I'm Terry, the creator and co-host of this podcast. I've lived with depression most of my life, and I know how easy it can be to feel all alone in the experience. I'm not alone, and you aren't either.
And I'm Dr. Anita Sands, a licensed clinical psychologist and life coach with a number of my own diagnoses, all of which bring a certain amount of anxiety and depression along with them. There is great power in shared experiences. We share our own as we engage in intimate and candid conversations with our weekly guests, exploring different perspectives on and experiences with depression.
We keep it real because depression is real. We keep it hopeful because there truly is hope in spite of what depression tells you.
Hi, Terry.
Hello, Anita. So if you listened last week to When Doctors Are Depressed, you heard a refreshingly candid discussion of mental health training, stigma, and failings in the medical profession. Frankly, it was kind of shocking. Yet for anyone in the field, it was likely no surprise at all.
Today, we're going to continue our discussion with trauma surgeon Dr. Michael Weinstein in an interview recorded a few years back. In part one of his interview, we focused on the institutional changes that he thinks are necessary to reduce and address depression among doctors and other healthcare professionals. Today, we hear about Michael's very personal experience with depression and the challenges and lessons of switching roles from being the doctor to being the patient. Michael begins with a bit of family history that, along with the many stresses of his medical training and work, may have increased his risk for depression. Here again is Dr. Michael Weinstein giving his voice to depression.
My grandfather, who for the last 20-some years of his life, he was depressed in and out of facilities, very aggressive treatments, and I think I saw that that's my destiny, and I'm not hitting it at 65 or 70. I'm hitting it at, well, I guess I was 48, and that's the only future I could see, and that's the scariest thing in the world, because that pain, when it's deep, really bad depression, it was just severe. Like every minute of the day was occupied with thoughts and feelings that I didn't know how to make go away, certainly, and didn't really even know how to lessen them. And you feel so trapped.
Were they all related to being worthless, being a burden, everyone would be better off without you kind of thoughts?
Yes, absolutely. You know, it starts more mild. It started more mild, I should say, for me at least, with thoughts of failure, and then finding, evidence of failure in everything you're doing, and then feeling, depressed about feeling like a failure, and it just keeps adding and adding multiple layers until I felt. I mean, it's hard for me to even say these days, but I truly felt that I was a burden on my family and my wife and kids, and that, they were the only things that were ever in my life holding me back from considering suicide. But I got to a point where I really thought my mind could convince me that they'd be better off if I weren't there. And certainly the world and everyone else would be a better place without me. You hear, I had never really heard those types of thoughts from anyone else, or heard people speak that way.
But what a dastardly illness. I mean, to convince you, A, you're not sick, you're just worthless, and then to tell you that the people for whom you would live, I don't even know what words to use. I mean, how as a community, as a medical community, as just a general public, do we communicate this to both sides, to the people who might lose someone with depression and to somebody with it? How do we say it's that bad and get involved? Or what's the message, doctor? Help me.
Well, I mean, I think the work you're doing, for instance, is key in getting this message out and hearing as many stories, especially when people, you know, I think when people are in the throes of it, it can be really hard to hear. But if people can hear these messages before that, and as they're beginning to recover, because everyone can recover, I really believe that so deeply in my heart. I remember the first day that it really was starting to lift, and I called my wife and just said, you know, this is the first time I'm just so happy to be alive, and so happy that that you guys kept me from taking action otherwise. And there's so many reasons and so many ways to find little bits of joy and meaning that it's I don't know how to get that message out other than keep talking about it and having these conversations and destigmatizing these conversations so that people can listen and hear it on national platforms, international platforms.
You described yourself as having treatment-resistant depression. And when I read that, I thought, oh, there will be people listening who are so glad to hear a doctor use that phrase because they've been told by doctors, you know, basically nothing works for you, like as if they're just difficult, as opposed to the things that they've been prescribed have been ineffective for them. So treatment-resistant depression, it's real and you have it?
Oh, God. Fortunately, right now I don't.
Good.
Which is interesting, because in the throes of it, so this is now going about 2 years ago, certainly the worst episode of depression I've ever had. Nothing was working. Nothing at all. Talking to all sorts of people, different types of therapy, constant attempts at medication changes. And so that is treatment-resistant depression, where there's nothing you're throwing at it is working, and it's so scary. I mean, I called it end-stage depression, which I'm not sure truly... I don't think truly exists in my heart, but I thought damn well I had it, and I thought I was never going to get better.
So we want to stop for a minute to say we're about to get into some of Michael's really rocky waters and talk about that place of lost hope. But please realize he is speaking about his past. Michael's in a different place now, and that is exactly why he's sharing his story. He wants to remind you, all of us, that things can and do change for the better. Please hold on. You are not alone.
I checked myself in with my wife to an institution for psychiatric care, and it was there voluntarily. I didn't necessarily want to be there. It was scary as hell just to admit that I was going to a psychiatric hospital. I certainly thought that would end my career.
Since Michael had tried so many treatments that didn't work for him, as both a doctor and a grandson, he knew what was next.
You know, the way the medical community sees the treatment of depression, it's medicines, some psychotherapy, and then there are the big ones. And they quickly recommended, aggressive treatment with electroconvulsive therapy.
He started that therapy and fell even deeper into depression's dark pit.
And then I sunk into bed and wouldn't get out, wouldn't eat, and I understand from their standpoint they were in charge of keeping me safe. And said, kind of threatened me if I didn't start getting with the program. This is what's going to happen. We're going to put you in the locked ward, and I freaked out.
Suffice it to say, Michael resisted. He was restrained and forcibly taken to an isolation room.
It's a really hard thing to go through. I get it. It's about safety. I think there are better ways to interact with patients when it comes down to those critical times that sometimes aren't always used in terms of de-escalation and ways of putting people on your side rather than forcing them to become defensive. But at the same time, as hard as that whole thing was, it was humbling to be amongst a different population of folks. It was also in some ways interesting. I learned about, kind of being on their side and being on the other side of this whole type of situation of care.
How'd you get from there to here?
What a crazy journey, huh?
Yeah.
So, being in the psychiatric hospital with other people who were, I was amazed. You have those types of thoughts too.
Yeah.
And so, I realized that if people could realize that they're not alone and that it's okay, and if anything, even it's a strength, and it's a courage to openly talk about these issues, and you don't need to be ashamed to do so. I wanted to show people that, because my main motive, I don't want anyone to ever have to go through what I went through. If I can possibly help you avoid this, I would really like to. It's amazing that, we can talk about the issues and we can talk about statistics. The story and the narrative is so powerful. I'm just amazed that people can always identify parts of themselves in someone else's story.
Yeah, you can say 350 million people, and you can say 1 in 4.
Right.
That's like talking about the national debt to me.
Right.
None of it means anything. I think that's a lot of people. But
Right.
when you say to me, and I was restrained, I feel that in my gut.
Right.
And I'm not going to forget that. What is the expression? What is personal is universal. It's also a way that we get to control the narrative. I think that that's very empowering in a way.
Yes. Yes.
In the article Michael wrote about his experience for the New England Journal of Medicine, he said, "My healing has been considerable. I am happier and more optimistic than I have ever been in the past 50 years.
I've recovered in ways that I really thought were I still find them so surprising. For a while, I wanted to tell the story that I recovered and everything is great and hunky-dory, and it's like the journey of the hero or something. And but that's not life, and life has its ups and downs, and it's learning to work with that and encounter those and realize that it's all just as it should be, and it will unfold, and it will, you can work through anything that arises. Every human has that possibility.
So, Anita, one of the things that Dr. Weinstein said, and in this episode we're calling him Michael because it's more his personal story, but when he said he was in the psychiatric hospital and that he said, "I was amazed. You have those type of thoughts too?" And this is a doctor, and he did not know what those thoughts are. And I mean, we talk about them all the time on this, and I'm not saying he should listen.
All the time.
All the time. I mean, it's really
All the
important.
time.
It's important for us to know for ourselves. So it's like, oh, these thoughts are a symptom. It's important for us to know, because if you start telling me you're having them, I can say, oh, it's good for you to know that that's a very common thought. And the doctors and the people who are helping us, of course, if we say we're having A, B, and C symptoms, you'd like them to be familiar with A, B, and C.
Yes. Yes, you would.
yes, you
But
would.
I'm not sure that level of specificity of these are the thoughts that a patient's likely to have if, they're in a major depressive episode. I don't think the average medical student is going to get exposed to that. I would like to think psychiatrists who are specializing that would, but someone whose specialty is in trauma surgery, I could easily imagine that caught him by surprise. That he did not know. Oh, that's very common depressive thought process right there.
Well, so I wasn't going to do this, but I want to jump in here because, at the risk of sounding self-promotional, we have put together compilations of people saying what their depression tells them. And so we literally have a 10-minute video that if anybody does need to hear, so that they understand the thoughts that they may be having are common, that somebody else may be having, so that they know what to say to start that conversation, as opposed to just, hey, if you're ever having bad thoughts. And then if there is anyone in the medical profession, reach out to us, Terry at givingvoicetodepression.com. That's Terry with a Y. And we will get you a screening of that video. So go on with your reactions to what you heard, because I just thought he was so forthcoming and so refreshingly real and not speechifying. And, he was still feeling what he went through.
Yes, he was not, he was not taking that objective view. He really truly combined, his knowledge and experience as a doctor. But then here's the thing that I really got from this: how powerful and how healing it is to hear this doctor being so human. And there's nothing like dealing with a mental health issue, a physical health problem, or burnout, to remind a helping professional that they are human, that they are human first, that they're not superhumans. And I don't think it's just the indoctrination in our programs that tries to make us think that we're somehow different or immune to, to those kinds of human problems. Sometimes it's coming from the people that we want to help. So clients and patients sometimes want to believe that helping professionals are superhuman. And it can be difficult to recognize that, nope, we're all in this together. We're all walking our paths together. We're human beings with some specialized training and a strong desire, passion, or calling to be helpful, but we're humans first.
More details of Michael's humanity in both his article and the YouTube video that we will be linking to with this episode. So thank you again, even though it was years ago, Dr. Weinstein. And thank you, Anita, for sharing your own personal experience about training and just the need to remind everybody that everybody is human.
Every human is human.
Right?
It sounds silly to say it, but it's true. It's so true.
All right, we'll be back next Tuesday.
We truly hope that our podcast brings a little more understanding, helps you better articulate and reflect on your own experience with depression, or better understand how to support someone else who is struggling.
If this episode has been of comfort or value to you, know that there are hundreds of others like it in our archive, which you can easily find at our website, givingvoicetodepression.com. And remember, if you're struggling, speak up, even if it's hard. If someone else is struggling, take the time to listen